very much for coming out on a Friday afternoon at 2 o'clock. Not an incredibly likely time for a panel, but it was a good opportunity for us to kind of get everybody together to talk about an important topic. I'm Jonathan Metzl, and I'm the director of the program in Medicine, Health, and Society at Vanderbilt. And I'm also a frequent loiterer here at NYU. And I've been here over the past year on a Guggenheim Fellowship and made a lot of connections in areas of kind of medicine and society and politics that led to some of the collaborations that this panel is a part of. We're actually going to be having a number of interactions over the coming couple of years between NYU and Vanderbilt in relation to what we might broadly call the politics of health, and through the center that I direct, the Medicine, Health, and Society, and social cultural analysis here. So this panel is actually the first of our initiatives. We'll also be doing something coming up in March, March 23rd, that looks at specifically at race and the politics of health, and takes a critical look at the so-called dialogue of what's called cultural competency in healthcare. And we're bringing together race theorists and physicians and urban planners and other people to look specifically at the ways in which race may or may not be understood as a clinical interaction. And what we're arguing at that panel is called structural competency. We're looking at how actually medicine might reshape its focus about race to look more at structural issues. But today, our focus is on the increasingly vocal attacks on science in the form of political attacks on scientific theories, scientists and scientific funding agencies, and on health in the form of criticisms of attempt to reform the healthcare system. Our panel this afternoon brings together journalists and academics to think more deeply about what these attacks mean in the current political climate, and to think seriously about the implications. Now, to be sure, attacks on science and health are not the same thing, and they potentially represent differing constituencies, economies, and interests. And I was thinking on my way over here about different ways in which we might think about attacks on science and health as in a way being different kinds, to use Ian Hacking's term. And you might think of, one might be a secular attack, one might be a religiously based attack, different economies, et cetera, like that. Another caveat we might think about in convening a panel like this is that these types of attacks on science and health really have been around for a very long time. In fact, several members of our panel today have vitally shown how rebuttals of evolution, climate change, complementary and alternative medicine, vaccine science, and a number of other issues have functioned as subterranean political platforms for conservatives for much of the past 20 years. And of course, anti-science has gone hand in hand with most vital forms of scientific discovery, from Galileo's heresy trial for refusing to back down from promoting heliocentrism to the attacks by Hobbes and Rousseau on the basic tenets of the scientific revolution. And yet, I would argue that something feels, because of course we're alive at this particular moment, not those other moments, something feels particularly chilling and exigent about the present moment in ways that I think raise the stakes for journalists and academics who wish to intervene. The economic crisis, as one example, has given rise to an air of instability in which public health itself seems up for grabs. Increasing numbers of counties, for example, are eliminating water fluoridation programs because of economic concerns, for people who read the newspaper this morning. Meanwhile, smoking cessation programs are on the rise. The EPA, NSF, NIH, and other agencies are on the chopping block. And increasingly, it feels as if we're seeing not just the erosion of the production of knowledge, but a kind of retrogressive erosion of knowledge itself. Moreover, current attacks on science take place in the context of a number of other very public assaults on history, economics, and indeed on logic itself. Over the past 6 months, mainstream political candidates have told us that slavery was in fact beneficial for the psychology of slaves, and that the economy can be fixed through a 999 payment system that comes from a pizza delivery algorithm. These other attacks on common sense serve to enhance the feeling that we live in a partisan age in which even the most fundamental forms of compromise seem beyond our reach. And if you don't believe that, just look at the NBA Players Union right now, for example. What then should journalists and academics do to bring light to these issues? Certainly one way to answer that question is very rightly to blame and expose particular politicians and political party ideologies. And indeed, It seems as if every passing day brings a new lowlight that in certain politicians or parties' assault on medical and scientific reason. This started when rank-and-file Tea Partiers stood at town hall meetings and demanded that they not receive health care coverage, and digressed to Michelle Bachmann's claims that with a straight face that rising carbon dioxide levels are beneficial because CO2 is a natural byproduct of nature, quote unquote. Rick Barry then decried climate instability as his state burned with wildfires, and so forth. At the same time, however, this causal narrative is complicated by a number of factors that trouble what we might think of as linear blame. For instance, attacks on certainty of medicine and science have not always been central conservative platforms. And even 10 or 15 years ago, anti-science arguments emerged from such ostensibly liberal rhetorics as postmodernism, feminist theory, science studies, and other approaches that took the social construction of science and health as ways to explore authority more broadly. Perhaps more importantly, scholars have increasingly shown that the emerging culture of individualized medicine and health responsibility have made it increasingly harder for people across the political spectrum to think about health and science in communal terms. These and other examples suggest that in addition to fighting back, the present moment also requires addressing a wider set of questions that lie at the heart of present-day attacks. And I'll just say in closing that such wider questions might include what broader ideologies do attacks on science and health represent? In other words, beyond the particular politicians, how is it that at this particular moment these attacks are given a hearing in a far more public way than they have in the past? Who stands to benefit from these anti-science and anti-health positions? To what means and to what ends? What are the cultural and political endpoints of these attacks? Should they, I would say, God forbid, become enacted into policy? What new coalitions need to emerge to fight back? And perhaps most centrally to our concerns today, how might journalists and academics better connect to intervene into particular political debates, either at the policy level or even at the downstream level with attacks on scientists or showing the real effects on people's lives? Now, we're honored to have a panel of fantastic thinkers and writers here to address these issues today. The format that we're going to have, I'll introduce the speakers, and then each speaker will speak for around 10 minutes, and then we'll have a set of framing questions in the end, and then open the conversation to kind of open floor debate, organize open floor debate after that. Then at 4 o'clock, our new coalition has basically bought a lot of wine and snacks, so people are please invited to stay at 4 o'clock, and we'll have a reception afterwards. So first we'll hear from Ivan Oransky, who is the executive editor for Reuters Health, the treasurer of the Association of Healthcare Journalists, a former managing editor of Scientific American Online. Under Dr. Oransky's leadership, the editorial team of the Scientific American won numerous awards, including the 2008 American Society for Business Publication Editors Magazine of the Year, Golden Eddy, and the Golden Eddy Awards for science magazines. He's also served as the founding editor of Praxis Post, and he's the author of 4 books, including The Common Symptom. Next, we'll hear from Perry Klaas, who's the director of the Arthur Carter Journalism Institute, right upstairs from us here, and an NYU journalism professor of journalism and pediatrics, and an eminent medical journalist. Dr. Klaas has published in newspapers and magazines, including the New York Times, Science section in Magazine, the Washington Post, the Boston Globe, the New England Journal of Medicine, Esquire, Parenting, and Vogue. She's also written a number of popular columns and is author of a number of books, including 3 novels and 2 works of short fiction, in addition to her medical writing. Next, we'll hear from next we'll hear from Eric Kleinenberg, who's a professor of sociology, public policy, and media culture and communication at NYU, and editor of the journal Public Culture. Eric's new book, Going Solo, The Extraordinary Rise and Surprising Appeal of Living Alone, will be published in a couple of months. February, all right. Professor Kleinberg's first book, Heatwave, won 6 scholarly and literary prizes, and his next book, Fighting for Air, led to testimony before the FCC and Congress. Then we'll hear from Esther Kaplan, who's a radio and print journalist and editor of the Investigative Fund at the Nation Institute. Esther has written for The Nation, The American Prospect, In These Times, and The Village Voice, and other publications. She is author saliently of With God on Their Side, George Bush and the Christian Right, which was published by New Press. And she's also co-host of Beyond the Pale, a weekly program covering Jewish culture and politics here at WVAI in New York. Then finally, we'll hear concluding comments from Thuy Linh Tu, who is associate professor here at SCA. She is the author of The Beautiful Generation, Asian Americans and the Culture Economy of Fashion, which was just published early this year, and co-editor of three edited volumes, and is currently working on a project on race and science. So thank you very much. We'll hear first from Yeah, don't hear. I can just speak this over.
Actually, I was actually hoping I wouldn't have to stand. Just
it
keeps it a little more informal. But I can't figure out what it is.
I got it.
What's up? See, we adjuncts.
Technology.
You know, we don't,
No.
They don't have all that fancy
Technology's out to get us. Scientists, so responsible.
Sort of leave it somewhere nearby.
Can you hear us if we speak loudly? Maybe.
I'll do this.
That seems
Okay, good.
Okay.
Make myself useful here.
I can speak pretty loudly also, so maybe that'll work. But I think they're recording it, so maybe that'll help. Thanks very much, Jonathan, for inviting me to what sounds like it'll be a really interesting and provocative panel. When Jonathan first asked me to address everyone, to talk and contribute to this, my first thought was of I think it's every 6 months now. Generally, it's the Republican members of Congress who find a list of NIH grants that they really don't like. And they come out with this list. It's usually about 10 grants, I think maybe 20. And there are things on there like, why are we funding this research into interviewing prostitutes, sex workers, at truck stops along the Mexican border? Well, there are actually a lot of good reasons why we're doing all that, but you can see how immediately everyone looks and goes, why are we doing that? What are we supporting these sex workers? What are we doing? We're trying to help them? What are we doing? You may recall also that Sarah Palin, in one of her many, many memorable comments on the campaign trail, went after some research that had been funded by, I want to say NSF, and correct me here if that wasn't right, maybe USDA actually, but it was definitely federally funded into Drosophila, which most of you know is fruit flies. And what are we doing studying these fruit flies? And we were paying someone in France to study the fruit flies. What an awful, awful thing to be doing with taxpayer dollars. Well, it turns out it was quite important to this little industry known as wine in California, what exactly was happening with these fruit flies. So, not to say one's right, one's wrong, but that's what sort of immediately came to mind. But then I started thinking a little bit about what I do every day, which is I run a team of people who covers healthcare, medical studies, and things like that. And areas where I've seen some sort of what I think are often troubling political interference, if you will, with evidence. And I'm more concerned, I guess, on a day-to-day basis, not to say this is more important, but with the political attitude toward scientific evidence than necessarily, attacks on science. And certainly that's a big, big important subject. But I'm looking specifically at some of these examples. So I have a couple that I want to just talk through and maybe really just open for conversation later. And one of them is actually quite timely, as it turns out. So some of you may know what the U.S. Preventive Services Task Force is. If you do, then you can check your BlackBerry for a minute or two while I give some details of what that is. If you don't, please bear with me. So the USPSTF is this government-funded, it's sort of a quasi-government agency that comes out with recommendations and guidelines for preventive services, preventive health care. What's preventive health care? Generally, we're talking about screening tests. Vaccines actually aren't in there. That's covered by the CDC, but things like that. So the big ones, of course, are colonoscopy for colon cancer, mammograms, and I should say, by the way, it's not just colonoscopy for colon cancer. It's any test for colon cancer, and in fact, there's equivalence among 3 different tests. I don't want to get into that level of detail today, because colon cancer isn't even on my list of things to talk about. But just to give you a sense of the sorts of things that USPSTF looks at. So about 2 years ago, almost precisely 2 years ago, you'll probably recall that there was a huge uproar over new guidelines from an agency, which, by the way, was Uspstf, about mammograms, about when women should start having mammograms. And not to come down right, wrong, otherwise here, but in a nutshell, what the guidelines did was change the sort of first age at which you should get a mammogram to 50 from 40. Okay? And, well, you can imagine there was quite a lot of uproar over that. A lot of people a lot of advocacy groups who want more research funding into treatment for breast cancer were obviously quite worried about that. A lot of people who make their living doing mammograms and breast surgeries and chemotherapy were also very concerned about that. And what ended up happening was, again, in a nutshell, I'm coordinating here, was a sort of PR nightmare. It was a real issue, and the USPSTF kind of realized that they had a communications problem. And they've actually come out and said that since then. But the central issue was, what is the evidence? Because that's what the USPSTF cares about. What is the evidence for efficacy versus harms, which you never hear about in screening tests? How many of you sort of think of a screening test and think of, oh, there might be a harm involved with that? Now, women who've had mammograms, my wife among them, millions of women among them, tell me that they're not such pleasant things to have. But even that is not thought of as really the harm. The harm is actually false positives in having to have biopsies, which have complication rates. In ending up being treated for something that may or may not, in some cases, even cause problems for you. Well, the USPSTF sort of learned some things 2 years ago, but some of you may realize that just this past week, the same agency, USPSTF, and again, what was bungled from a journalistic sort of PR point of view and not necessarily a communications point of view, we haven't gotten there yet, they came out with new recommendations, new guidelines for PSA screening. PSA is a test, prostate-specific antigen. It is basically a protein in the blood that you test your prostate. And again, I talked about mammograms, and I'm going to talk to the guys in the room supposedly. Your prostate makes this protein, circulates in the blood, and it is at best controversial way to test whether or not you have prostate cancer. And what the USPSTF said here was actually even more sort of strict, if you will, coming out against prostate testing, for prostate cancer screening using PSA. They said the harms clearly outweigh the benefits. We actually recommended against it, which is even stronger than they had said in terms of the mammograms for breast cancer. And so what has happened? Same exact thing. It's like you could look at this as if you wrote a script and you gave it, and you just took out all of the words that referred to breast cancer mammography and put in prostate cancer and PSA, you would have exactly the same thing happening. Why am I bringing this up here? Obviously, there's going to be furor over guidelines like this. Well, what happened 2 years ago with PSA, let me back up. What happened with mammograms, and what happened 2 years ago, was the Obama administration actively distanced themselves from this recommendation. Well, why is that? This is a health recommendation. Why shouldn't they just look at the evidence? Well, what happens is that a lot of insurance companies follow Medicare, and Medicare basically follows USPSTF because it's like I said, a government-funded agency. And in the case of mammograms, that's a little complicated because there aren't that many women between 40 and 50 on Medicare, very few in fact. But the insurance companies will follow. So what the concern was that a lot of insurance companies would stop paying for mammograms. And the USPSTF doesn't come out and say no woman should have a mammogram between 40 and 50. They say it shouldn't be a routine screen, which is an important distinction. But Kathleen Sebelius, the Secretary, thank you, of Health and Human Services, came out, distanced HHS and therefore the administration from this recommendation. Well, what happened this past week with PSA not everything's played out yet, but I can tell you that we made a very small error in the story that we ran about, the very first story we ran about this. And I hope I don't sound defensive when I say that it was a very frustrating experience to write about the PSA testing because everyone, even though CNN broke the story of the Times, then had it very conclusively, they wouldn't release anything, which is crazy. And CNN and the Times absolutely did the right thing, and then everyone else didn't do the right thing, and I mean that in terms of the Uspstf, because they didn't release any information. We were working blind, we were operating in the dark here. Anyway, the mistake we made had nothing to do with the recommendations. The mistake we made was that when it went through copy editing, the story somehow ended up saying government agency instead of government-funded agency. And the reason I bring up that seemingly unimportant detail, that really was just an error that we fixed very quickly, is that we got an email, not from, the office at AHRQ, which runs USPSTF, sorry for all these acronyms, that's the government for you. No, we actually got an email from someone in the executive office of the president. This is someone extremely close to a certain president of this country. Again, and they are actively trying, they will be actively trying, clearly, to distance themselves from this recommendation that men should not get this test. Why? Because we have the right saying, anxious and waiting for another excuse to use the concept of a death penalty. So now we have the USPSTF as a death panel because they're going to decide that men shouldn't have a test. And quite frankly, the evidence, you can actually argue about the evidence of mammography. You can look at the number needed to screen and look at whether you're comfortable with that number and make a rational decision. When you look at PSA, because most men who develop prostate cancer will not die of it. 80% of men will develop prostate cancer by the time they are, I think it's 70 years old, 75 years old. But most of them will not die of it. The vast majority will not die of it. They will die with it. And so there's this political insertion into this, not actually the decision-making process, because the decision was made. But what had happened with PSA was they had actually made this decision 2 years ago. And then when they saw what happened and mammography recommendations came out, and they put it on hold. They actually put it on hold because they did not want to deal with this political and other firestorm. In fact, last year, there was actually a meeting scheduled the day before the midterm elections to discuss PSA testing. They canceled it. Actually haven't held it since. Because and there was a great piece in the New York Times magazine just this past week by Shannon Brownlee, Jeannie Lenzer about this, which finally confirmed what most of us who've been following this know for a long time, which is that it was a political decision. They didn't want to have any ammunition for anyone to say, look, the Obama administration and all of the Democrat Congress by extension, are trying to destroy healthcare or stop men from being tested, death panels, et cetera, et cetera, et cetera. So all of this is coming out now. And I just wanted to sort of share that as not as an opposite, but just as a very specific example. And I just wanted to close by saying that one of the things that Jonathan mentioned, I'm a member on the board of directors of the Association of Healthcare Journalists. We don't like to ghettoize healthcare journalism. We don't like to ghettoize science journalism. Because what happens is then everyone starts thinking that only their area is the one that's covered badly. I'm very comfortable saying that however bad any particular area is, it's true in many other areas. Of course, there are outstanding examples of it. So I look at it and I look at other colleagues at Reuters who don't cover health and medicine, and I think we all are struggling to improve what we do, not just in health and science journalism, but everywhere. So, thank you.
Hi, I am actually a pediatrician, and I would like to start by telling you two different stories sort of from the pediatric side of my life. First, in an exam room with a parent and a baby up at the clinic at Bellevue where I work, and a resident in our clinic, a pediatric resident, had come to see me and said, I have a mother here with a 6-month-old and she's refusing immunization, which is actually pretty uncommon in our clinic population. Many of the people who refuse immunization are, there's an extremely high rate of vaccine refusal in Marin County, California. Okay, it's often associated with very privileged people. Many of our patients at Bellevue actually are recent immigrants. Many of the parents and grandparents have very vivid memories of some of the diseases against which we immunize. Measles is a real thing in their minds, whooping cough. And also, many of them have come from countries where healthcare is not available for children as a matter of course. And so generally, most of our patients say the same attitude that my grandmother or my mother would have had. You've got a new shot, please, quick, give it to my baby first. Let me make sure I'm at the head of the line. But so that for that reason, our residents are not as accustomed to dealing with issues of parents who are anxious about vaccines. And he was, quite frankly, very frustrated that this mother was refusing vaccines for her 6-month-old, and I ended up going into the room to kind of talk it through. And before I went into the room, he said, "And what are we going to do if she keeps refusing?" And I said, "We're not going to immunize the baby. It's her decision, but we are going to tell her that every time she comes, we're going to bring it up and we're going to talk about why we think it's important, and we're going to try to do that without making her feel that we think she's a bad person and a bad mother, but we are going to have to use words like illnesses which can really hurt a baby, may only make a baby sick, even kill a baby." Anyway, when we went in and we talked some more to this mother, what emerged, and this was not actually very surprising, was that there was a child elsewhere in the family with autism, and that the mother of that other child had told this mother very clearly, "If only I had known before I immunized my child that vaccines can cause autism." And so that what we had been asking her to do in that initial "will you please sign this" was go against information that she had very directly from somebody that she trusted. And she was, we sort of had the long vaccine talk, and at the end of the long vaccine talk, she was actually perfectly willing to have the child immunized, and she was sort of totally reasonable about it. But what I noticed in our initial conversation was that all of our feelings were kind of hurt. The initial resident, who, we all become pediatricians because we like children, we expect to be trusted, mine a little bit, the mother's a little bit, but she wasn't being sort of done a bad job of the initial communication, asking the right questions. The second story is that earlier this week, I was talking at a children's hospital in Cincinnati, and I was asked to do noon conference with the residents, and it's a huge program, there were like 80 pediatric residents and medical students. They asked me to talk about combining writing and medicine, and I thought I was going to give this extremely sensitive talk about how we all have these wonderful skills and feelings as physicians, and we have all these wonderful stories to tell. That's not what they wanted to talk about. They wanted to ask why the journalists who write about medicine do such a bad job, and what they especially wanted to ask about was this same issue, the vaccine issue. Why do people keep writing stories in which first you quote somebody who says vaccines are good, and then you quote somebody who says vaccines are bad? Why do those stories keep coming out? And they were citing specific stories. And one of the things that I ended up thinking about and talking to them about and saying is that there are a lot of reasons why that coverage happens, and there are a lot of reasons why it's so unsatisfying, especially to those of us who are practicing. But unfortunately, it has to be acknowledged that one of the reasons that happens is, and I see this when I teach journalism students upstairs, if you want to talk to somebody who thinks that vaccines are an evil government plot, or that vaccines are horribly damaging to children, those people will return your calls, they'll return your emails, they'll send you information, they'll meet with you, they'll send you horrifying videotapes, they're all over it. They really want to talk to you. You want to be put in touch with a family with a heartrending story, they'll put you in touch. The developmental and behavioral expert at the hospital where I used to work, a pediatrician who did nothing but treat children with autism, would not return your calls. First of all, she was tired. This has been asked and answered. This has appeared a million times. I've got a waiting room full of kids. I'm not going into this again. And second of all, she was scared because some of the people have been attacked online. Paul Offit at Children's Hospital Philadelphia, who's written extensively about this, has written about getting death threats from the anti-vaccine people. Just didn't want to be out there holding the flag for vaccines. And that has been, to some extent, I think, true throughout the pediatric profession until quite recently. It's been much harder to reach the people who can tell the other side of the story. And just as with the mother in the exam room, we weren't necessarily really listening to what's behind the questions, and we weren't necessarily answering them as well or as passionately as we could, and that shows up in the coverage. So when I was writing about pediatric issues, I had actually said to myself, you know, there are certain issues which I just really don't want to touch because I know what all the response is going to be, and I just, you know, get tired of dealing with the crazies. And one of them was going to be vaccines and autism. And then a couple of years ago, when we were having the H1N1 controversy, and I was working at the clinic, and we had just gotten the pediatric H1N1 vaccine, and we were having this sort of very strange bipolar experience in the clinic, in which on the one hand, a lot of families were scared of it because they'd heard it was a new vaccine. And then on the other hand, you'd sit there and the phone would ring and someone would say, do you have the H1N1 vaccine? Do you have the H1N1 vaccine? And you said, yes, we have it. And people would start to cry. I've looked everywhere. I'm so scared. My child has asthma. I heard he might die. Can I bring him in right now? And so I ended up writing home for you about this sort of weird experience of, on the one hand, there are people desperate for vaccine, and on the other hand, there are people who are terrified of the same vaccine. And I actually called Paul Offit at Children's Hospital of Philadelphia, and he said it's like the Woody Allen joke in which the two women are complaining about the meals at the Catskills Resort. And one of them says the food is so terrible, and the other one says yes, and the portions are so small. And I used the quote, and the column went up on the New York Times Science Section website late that night, and the next morning I had a death threat on my email, which was really kind of interesting. It had not ever happened to me before. And I had this sort of unusual experience of calling the FBI and having them screen it in and explaining the whole business to them. It was, by the way, signed with the person's full name, so I was able to Google him. And as the FBI agent said, most of these people didn't give up careers in rocket science. And learn all about him and find out. But he was well known to them, and he is and he had paranoid schizophrenic. His face was up on a photo in various hospitals, and just that feeling. I remember thinking, wait a minute, I thought I was never going to touch this. Well, guess what? It turns out that some of this is kind of goes with the territory. And 2 minutes. Well, a couple of other things that I wanted to say then. What are the other stories that provoke this same kind of absolute, passionate, the science is wrong, the more scientific you get, the more wrong you are, the more you quote experts, the more you prove to me that my worldview is right, the more people you cite, the government agrees, all the scientists agree, all the studies and all the medical journals agree, makes my point, proves it. Vaccines are kind of the most obvious high-profile example of the last few years. I wanted to mention just a couple of others which have come up recently. Just earlier today I was talking to someone about children's mental health, and someone used the phrase ADHD denier. And I immediately knew exactly what that meant, because if you write about attention deficit hyperactivity, you immediately get the emails from people who believe it's parents who can't set limits who are medicating their children because they, want to drink cocktails. It's teachers who can't set limits who are medicating the children because they can't control the classroom. And what's interesting is that you can actually get two diametrically opposite beliefs held. This is a perfect doublethink. It's racial profiling, in which people are medicating and hyper-medicating minority boys because they want them to sit and be quiet, or it's privileged rich kids whose parents can't accept that they really need a spanking, so they get them diagnosed and medicate them instead. And all of these beliefs can be held at once. And again, you've got some neuroscience, you've got some brain scans, you've got a government commission, proves my point. Everyone's in the commission. And then the last one, just to go with your PSA screening, the circumcision people, or the anti-circumcision people. The Times put up a little story about, not an opinion, about circumcision rates in the United States and what's happening. Are people circumcising their sons? So fast, there were 200 furious responses. And for the responses for all of these, I have to say, there is some correlation between the inability to spell and to punctuate and the desire to put, very strong opinions up in response to stories, but also this same feeling of the more science, the more expertise you can marshal, the more you show me that the weight of opinion is on one side, the more you prove my point. And that's kind of the challenge, to write in response to that and to communicate in response to that, while at the same time listening to the very real anxiety and the very real fear and the very real worry, which prompts the people who are worried and are responding and are not necessarily following our recommendations. And then the last thing I'll say is, of course, in your quotes from recent would-be presidential candidates, you didn't mention the one about HPV vaccines that Michelle Bachmann came out with, and I'll close on that note.
So my goal is to be short and incendiary because it's Friday afternoon, and Jonathan promised to debate, and I sat around, looking at the audience and looking at my fellow panelists, thinking we're not really going to debate that much here because we largely are on the same team, and I can think of some areas where we could probably spark a debate. So I'll try to do that. And that might be picking on my host a little bit, but why not? One of the problems for us here is if we wanted to have a debate by bringing in the anti-science crowd, this could soon turn out to be disastrous, right? One possibility here is that we are just beyond dialogue, and that the kind of points can't be worked out with reason, which is what we do here in the university. So it would probably be not so productive. And then we'd probably also fear that if we invited the anti-science group here to the university, we would be honoring, maybe even legitimating that perspective in some way. So we tend to keep keep them at arm's length, and we don't actually engage with one another. And as I said, maybe there's not much to engage over. We don't want this to become a free-for-all. But let's face it, we won't have that much of a debate. Now, we could probably debate a few things, even though we're probably all on the same side when it comes to our faith in climate change science or evolution. So I'm a sociologist. I think of myself as a social scientist, and part of my training involved learning about the philosophy of science and a little bit about the history of science. But I went to school in a multidisciplinary environment. I live here in NYU in a multidisciplinary environment. I edit a journal that goes between the humanities and the social sciences. And I just want to key into one thing that Jonathan mentioned in the beginning of his remarks that has to do with critical studies of science, the postmodern turn. I can't tell you how many classrooms I've been in which an attack on positivism as an ideology, as if it were a coherent ideology, and an attack on empiricism as somehow being narrow or even naive, comes from the smartest people around. The smartest people in the room with degrees from high-profile, fancy universities, people who are on the faculty of many of these universities as well. And so, in fact, it seems that if we want to think about science more expansively, we might be able to come up with some areas in which the fact that we know about mistakes that scientists have made enables a kind of criticism of science as a form of epistemology that is often very naive. So let's face it, science proceeds through error. Right, the way that science advances is that you discover that something that seemed like it was right is wrong, and then you improve on it. That's what science is a process. And yet, the aha moments when you discover that scientists have gotten something wrong can be quite spectacular. We can talk about their kind of spectacularness in the public realm, but they can be spectacularly powerful to discover as well. So think about how badly we got the science of race. Think about eugenics and craniology, for instance. If you know this terrific book by Steve Epstein called Impure Science, you'll know that his account of how medical treatment for people with HIV and AIDS improved dramatically when social movements, constituted largely of people with HIV and AIDS and their families, got involved in the fight to change the way that disease is managed. Scientists left to their own didn't get it right. They missed a lot of things. I'm still reeling from the fact that Pluto is not a planet. And this is something we have to talk about with our kids. So scientists get stuff wrong, and one of the fundamental things that we have to deal with here in this country is that we do a pretty poor job of science education. Now, I'm not going to argue that the reason that we've seen these organized attacks on science is because Americans are less educated when it comes to science than we once were. This has been a long-standing issue here. But we do have a kind of susceptibility because we have such a hard time teaching young people to think about science and to do science education seriously. And I want to throw that out as one thing that we could potentially discuss. For me, the driver for a lot of our kind of recent concerns about this issue is the internet. And Perry, I think, made a very useful point when she talked about this kind of process that happens when you're a reporter and you've been assigned a story and you're looking for someone to speak out and you start doing outreach, and it turns out that there's one side of these debates that's very organized. That's clearly something that you find. But the internet does something else in this kind of search for facts and for theories and information, which is it allows everyone to seek out and to discover their own facts. Right? It's possible to get your own facts almost no matter what you believe. But it does something more than this. It allows you to get your own facts as an individual, and then it allows you to find other people who share the same interpretation of those facts. And you can organize in a community that has a very real life and that can orient you towards different kinds of action and persuade people who might not already agree that this is a kind of community that's worth paying attention to. So there's controversies about vaccine that have gotten a lot of news attention. I thought that this moment that you described about H1N1 was especially fascinating because it was a very difficult question, in fact, when we started to get worried about swine flu and the possibility that this could be a pandemic like the flu of 1918, that there could be very dire consequences, millions of deaths, millions of hospitalizations. The estimates that came from the White House, for instance, were really high. And many virologists predicted that there was a high probability that something like that could happen. So what should you do? You have small children who live in New York City and go to public schools and would be in sites where they'd be potentially exposed to what could be a very dangerous virus. Should you or should you not get your child vaccinated? How do you think about that question? And it turns out that we go to the internet to find answers to those questions today. I was really struck by the extent to which within my world there were people who took dramatically different positions on this. Right? And so I think that the power of the internet is in some ways amplified by the fact that we are in a moment where there is a kind of distrust not just of scientists but of experts in many different communities and constituencies and fields. Distrust of expertise is in some ways a kind of cultural signature of our time. It's something we do. We live in an age of participatory culture. We believe that we actually can do better than experts on a number of things, and we have very prominent intellectuals who claim that, in fact, the wisdom of crowds is oftentimes smarter and more reliable than is the wisdom of experts. Now, when exactly is it smarter? When is it less reliable? When is it dangerous? These kinds of things turn out to be very tricky. But I think one of the things that we have to figure out today is how do we engage as experts from the scientific community? If you're a journalist, how do you report on these kinds of controversies, given that there's this distrust of expertise, and given that in this participatory culture, groups will find real success seeking out facts and theories that suit their interests. So last thing I'll close with, just to make it clear that I think this is not just an American phenomenon, was the reaction to the triple tragedy in Japan, which I've been looking at very closely recently, the earthquake and tsunami and the nuclear meltdown. When here's a case in which the scientists who took official positions for the Japanese government and who also were said to have informed TEPCO, the utilities provider that ran the nuclear facilities, were, in retrospect, dramatically underreporting the extent of the damage. Many people in Japan were cynical about whether they'd get good information. They didn't believe their government. They didn't believe the official scientists who were speaking out. And we saw something incredible, which is the kind of use of Geiger counters by ordinary lay citizens to challenge the estimates about the extent of the radiation in different parts of Japan. But then, of course, this popularized and became a kind of international phenomenon. So in the immediate aftermath of the triple tragedy, there were people all over the world who were using Geiger counters to post information about the extent to which radiation had spread. Now, this, of course, is a legacy of Chernobyl, in which it was a discovery made by other nations that there had been this massive nuclear accident. But it expressed in some way both a kind of distrust of government officials, a distrust of certain scientific authorities, and a capacity of ordinary people to produce their own facts, whether they're right or wrong, and to try to mobilize those facts for a reinterpretation, a reanalysis, a critical take on what people were told to do. And at certain moments, I'm wrapping up, at certain moments, a crisis or a pandemic, getting good information that's actionable can be significant. It can be a matter of life or death. Do you evacuate if you live near the nuclear facility? What if you live 5 kilometers away? What if you live 10? What if you live 20? What if you live 50? And I want to suggest that these are not the kinds of questions that we are immune from. At some point, we might have to answer those kinds of questions, and if we do, we'll rely on scientists and we'll rely on journalists to get us out of that. So maybe we can debate those things.
This point that you made about the fragmentation of knowledge in the age of the internet really resonates with some of my travels reporting on the Christian right. We're talking with, a whole range of people, from abstinence-only advocates to GOP congressional aides. I would hear some version of, you have your science and we have ours. And there was this real sense of, like, finally we've stepped up. We've marshaled our own evidence. Jonathan in his introduction was talking about this sense that we're at a particularly chilling moment right now in terms of the attacks on science, which I very much agree with. And I wanted, in my remarks, actually to just do a little bit of forensics about how we got here. And I think it has to do with two separate trends that have converged in the last decade or so to very detrimental effect. And one is the development of fake Christian science in this country, which sort of dates back to the beginning of the 20th century, and the other is the development of fake corporate science, which dates back more recently, maybe around to the 1950s, as a concerted corporate strategy. In terms of the Christian thread of this story, I think theologian Karen Armstrong, whose work I'm sure people here are familiar with, a former nun turned author, talks about how religious fundamentalism around the world actually rose in reaction to modernity and scientific rationalism. And in the process, fundamentalists actually absorbed many of the tenets of science. She writes, because by the end of the 19th century, science and rationalism were the watchwords of the day. Religion had to be rational too if it was to be taken seriously. It must be clear, demonstrable, and objective. And she finds this in Christian, Jewish, and Islamic fundamentalism. But this was very new, because before this, religion was mystical and mysterious and transcendent and was not seeking to play in this world of proof and evidence and science. But it's during this period that American Protestant fundamentalists begin to insist that the Bible is literally true. Again, that's a development of the last century or so. Literally true without error. And this is when the first religious attacks on the theory of evolution occurred, before those ideas kind of could coexist. And of course, as probably everyone here knows, these days such thinking has become nearly dominant. A recent Pew survey found that 40% of Americans believe the Bible to be literally true. So then with the political rise of the Christian right in the 60s, 70s, 80s, and 90s, the movement, and this is crucial, began to build institutions devoted to this sort of pseudo-scientific demonstration of the truth of the Christian right worldview. So now there's this whole sort of shadow scientific infrastructure kind of imitating the mainstream scientific infrastructure that comes with a pre-formed ideology. So there are biblically based groups of medical doctors, such as the Christian Medical Association, where to be a member you have to believe in the divine inspiration and final authority of the Bible and must commit to living out the character of Christ in your medical practice. There are biblically based research groups, such as the Medical Institute for Sexual Health, which marshals shoddy data or unpublished graduate student theses discounted by experts in the field to show, for example, that condoms don't work, that abstinence is the only way to prevent sexually transmitted diseases, or organizations like the Institute for Creation Research, which runs its own creationist graduate school and purports to find geological evidence of the Bible's Great Flood. There are now even biblically based so-called peer-reviewed scientific journals. This is very recent, such as one journal called Adolescent and Family Health, where questionable research is given the imprimatur of like-minded biblical literalists who also happen to be MDs and PhDs and can constitute a peer review panel. And this goes into every area. It's not just creationism, it's not just sexual health. If you go to a Christian homeschooling conference where all the vendors are arrayed to provide textbooks for the millions of children being Christian homeschooled in this country at this point, there are literal, biblical literalist versions of biology, of geology, of astronomy, of history, of social studies, of literature. It's every realm, and people can exist now kind of cradle to law degree, like one of our presidential candidates, Michelle Bachmann, or to medical degree, like Senator Tom Coburn, in this bubble of kind of protected scientific information, or so-called scientific information, that you're only exposed to if it conforms with your biblical worldview. On the industry side, epidemiologist David Michaels, who's now at the Occupational Safety and Health Administration in the federal government, has traced the rise of such fake science institutions to the campaign launched in the early 1950s to discredit the growing body of evidence linking smoking to lung cancer and other fatal illnesses. And the title of David Michaels' book, which I really recommend, is Doubt is Their Product, which I think really expresses the strategy of these industry scientists. And it's precisely the point you were making, that the scientific process is based on doubt, it's based on uncertainty, it's based on being open to contrary evidence. And the corporate pseudoscience strategy is, let's put together enough seemingly contradictory science to create doubt in the minds of the public and of policymakers. And this is the same with Christian right activists who exploit small disagreements among evolutionary biologists about specific mechanisms of evolution to say, okay, the whole theory is discredited. And that's the same thing that's used by fossil fuel company scientific front groups to challenge global warming. Well, there are disagreements on this exact bit of data or how we interpret this data, therefore it's all bunk. And the idea is to manufacture doubt. And again, their science and our science. So we have, in addition to the rise of this Christian right infrastructure peddling fake science, we have the rise of these organizations such as the Tobacco Industry Research Committee, the American Petroleum Institute, the American Meat Institute Foundation. And then, in recent years, we also have the rise of a very well-developed infrastructure of conservative think tanks, such as the Heritage Foundation, who pull these questionable scientific reports from both these Christian right science institutes and these industry science institutes and wrap them up as nice congressional briefings or white papers and disseminate them to the public and get their fellows, their distinguished fellows to do the rounds of cable television talk shows, pushing out these talking points. So I think we do have a very different situation now than we had a few decades ago because of this very, very developed infrastructure of fake science that's coming both from the titans of industry and also from the broad, deep Christian right movement. One of Jonathan's questions before we all convened today was whether this pseudoscience that's being circulated these days from everything from abstinence education to global warming represents fringe or mainstream beliefs. And I think it's clear from everything everyone's said today, but also from polling, that fake science has tenaciously caught hold. And that, in fact, it's helped over the past decade to create a political culture that is almost entirely divorced from the facts. That Saddam Hussein had weapons of mass destruction, or that Barack Obama is foreign-born and a Muslim. There are any number of complete fabrications that are now accepted as truth by a very, very significant plurality of Americans, in some cases by a majority. That even the future of our trashed economy is being debated by Republican congressional leaders and presidential contenders, as it just was the other day, without any reference to actual facts, to the actual causes of the economic collapse, to the documented effects of financial deregulation, is just one of hundreds and hundreds of measures of how these religious and corporate attacks on science have led, I think in a very broad way, to a devaluation of truth itself, reality itself, the whole idea that in order to make policy and politics that we need to first agree on what is really going on.
Okay, well, I feel like I've been had. Jonathan pulled me onto this panel asking me to do framing questions because he said it would be easy, but hearing all these speakers, I don't think it's an easy task at all to sort of pull everything, all these kind of rich comments together. So what I'm going to try to do is just sort of bracket them into two different sections, right? And maybe pull together some of the strands and then open up new questions for us to puzzle through together. And I'll break them up into these two sections just because this is the way Jonathan pitched it to me, right? But this panel is really about, the attack on science. So what is this attack? How do we understand this attack? Where is it coming from? Why is it here? And what can we do about that? And Jonathan sort of poses a question, what journalists and academics can do about it. But certainly, Eric is drawing attention to a whole other sector of the population that can do something about it. Sort of the person who's, measuring the radiation level in Japan, by themselves, right, coming up with their own information. So I think what's really been so apparent on this panel is the ways in which, what we think of as, the attack on science is actually really quite diverse and takes on many different forms from, what Esther just so brilliantly outlined for us, this kind of developed infrastructure for, fake Christian science or fake corporate science is one strand, right? This strand that Ivan was sort of highlighting is this kind of, what you call a kind of political interference with evidence, which is in some ways distinct from a kind of generalized attack on science, right? And to, what Perry and Eric were kind of highlighting, which is this sort of just mystery, anxiety, and confusion people have about how to make choices about their health and the health of their children, and the sort of everyday questions that people have about things that they don't understand or don't feel like they can understand. So these are, so that what we think of as an attack on science is actually quite multifaceted and multi-layered. And I guess the question that comes up for me is, given the ways in which, when we bring up this topic of attack on science, people always say, well, it's not just a conservative thing, liberals attack science too. And, you brought that up, Jonathan, certainly in the reference to the science war, which you also brought up. I think it's really, I think it's true, but are all these different forms of attack the same, right? Are all these forms of attack equal, or do some bear more power than others, right? And you brought up the question of funding. I think that all these different spheres of attack have different relationships to things like funding that have real practical implications for how we live our lives today. And then I guess the other question that I think maybe we can think over a little bit more is, why are certain scientific ideas or practices more susceptible than others to attack, right? Why is vaccination, right? And I think you're right that you can mobilize the infrastructures to produce doubt, but given that science has always been about doubt, right? Why are certain things so susceptible to attack, right? What kinds of sort of anxieties or confusions or hopes or dreams or whatever are they tapping into that people fixate on vaccination or evolution or climate change, right? As opposed to other things that, have always been shrouded in doubt, right? I guess in terms of what we can do, I think this is the less developed, right, of the comments we've had, and I think it's always the case, right, that we see the problems, we're not entirely sure how to deal with it. And I think Eric's point about sort of the internet and the potential of the internet, both for misinformation, right, and for sort of marshalling communities that could provide new information, I think is one of the things that we can sort of think through. But I guess, the larger question that Jonathan posed, what is the broader ideology that's at work here and who stands to benefit from scientific attack, isn't easily answerable, right? And it isn't easily solvable. I think part of what sort of, the larger framing of this is we live in a nation that has always had a real reverence for expertise, right? Doctors know best, teachers know best, fathers know best, right? At the same time, a real healthy distrust of expertise, right? Teachers are eggheads, they're so out of touch, right? And I think these always have been conflicting impulses in this culture, right? In both productive ways and really counterproductive ways. So, is it just a matter of better science education? Is it just a matter of more information or better information out there for people? Or is this kind of doubt and question and critique? And is there something in the development of bioscience today that begs critique, right? That is not just a kind of ideological position, right? But begs the level of critique that can be read as an attack on science. Okay, so maybe I can just leave it there and let all of you jump in.
Well, thank you so much, Twee, and all the excellent panelists. I would say, that Twee gets to get me back as I'm the respondent on your panel on Saturday. So, I think turnabout will be fair in that regard. But I do think it leaves us all with a series of really interesting and important questions, and particularly in relation to, I think, the excellent themes that run through, and in part, the question of what is emphasized or highlighted or telescoped by this discourse, but also what is left out. So we've had a whole conversation here, for example, that didn't talk about pharmaceuticals, for example, or the role of science and government policy. There are other ways in which, certain things that maybe you could even think of as having more effect than whether or not people believe in evolution or something might have an effect. So I know we've got a lot of people in the audience with a lot of expertise in these particular issues. So we'll open the floor to a kind of roundtable kind of conversation. If you could just please speak up when you ask your question, because we're trying to do an MP3 for the website here. So unless you don't want it to be heard, we can upload it or something. So great. Michael.
Yeah, I was in general about the comments for the cycle. I appreciate the discussions comments as well. I guess my question is for the second speaker, because I was struck by what you said about, I guess, misinformation. What you're interested to be misinformation around, say, ADHD diagnosis and those kinds of phenomena. And it seems to me that your position was that people should trust the science more than they do. But I was curious, because I guess there are even sociologists or anthropologists who would say that there seems to be kind of that ADHD diagnoses have accelerated at a rate which seems to exceed adequate scientific evaluation. Yeah. So I was wondering if you could clarify the point a bit more, because I didn't want to mistake your point for saying that the science is always right with that kind of issue. And just to toss out sort of another example where people wonder the extent to which the science is correct. There are a lot of school systems, public school systems, where African American men are sort of seemingly disproportionately being placed in special education classes, right? The notion is somehow that they are intellectually not even adequately developed. So it's beyond remedial, since it almost plays like disabled, right? But there's another reading of that, which is that they lack certain fundamental skills, thus are not equipped to compete with their peers in the same age and class. So I was wondering how do you think people should grapple with the science? Is it that there should be more investment in science, or how would you complicate this narrative of people trusting their family members rather than science? Or something else there? In light of some of the comments that Eric and people have made about how people, the kinds of ways to evaluate evidence.
Thank you. Well, sure. First of all, what I was trying to say with ADHD is I was trying to use it as an example of areas in which there is a sort of vehement knee-jerk response, which is always the same, and which, if you're trying to talk about it from any side, makes you aware that these people aren't listening to you. They're making their own. You sort of, pressed a switch, and you're getting their speeches, which have nothing to do. That's why I said they can either be telling you that it's being used as a weapon against, minority boys, or they can be telling you that it's being used as a way not to discipline upper middle class white kids who really need, limit setting. And it doesn't really, and it's sort of that you set off these sort of cascades of very emotional, anecdotal conversation, which don't actually have anything to do. Now, ADHD is a really interesting example of a lot of things, because first of all, I think anybody who works in the field scientifically would tell you that 10, 15 years from now, people are going to look at where we were with diagnosis and treatment and understanding of that set of issues, and they're going to say, wow, things were crude in 2011. It's amazing. They were going at this, the tools they had, the imaging they had, their understanding. That was just, it was that, boy, I'm glad I wasn't doing that. And I think everybody in the field would acknowledge that. On the other hand, the thing which strikes me most, actually, about ADHD is not that people won't listen to the scientists, because people will or they won't, but when I've written about it, what strikes me most is the people who won't listen to the parents. Because if you talk, as a pediatrician, if you talk to parents who have struggled with children who are struggling with this diagnosis, it's so far from the way people characterize it when they're angry at the experts. Oh, people just want to medicate kids because they're lazy. Oh, people just want to medicate kids because they're poor. Oh, people just want to medicate kids because they're rich. No, I've never come across any one of those people as a parent. And many of those parents, the really interesting stuff that goes on is actually at the intersection of expertise and clinical care here, precisely because the science and the expertise is evolving. And what I find interesting is that the people who are angriest about it don't want to listen to either side of that conversation. They know what's true, and it has nothing to do with what the parent is expressing or what the experts and practitioners are expressing. So it's a really interesting, really complicated area, and it's one of those areas where it's very easy to look at the comments and start diagnosing the people who are making them, so you have to resist that.
I will just very briefly add that we recently did an investigation about medication of foster kids, and it is, statistically true that foster kids are radically over-medicated, and there's a lot of potential reasons for that, one of which might be this sort of control narrative. The other has to do with reimbursement structures and things that actually encourage that, public policy kind of side effects. So there's definitely like a real world version of this. It may not be happening with regular public school kids, but at least for kids who find themselves in the foster care system, there's a very, very heavy diagnosis level for things like ADHD.
And also, well, it's a whole other issue, but a really poor medical care, sometimes for very well-intentioned reasons, like to preserve their privacy. But it's the only system I've ever been in which the people who are sometimes taking care of children are responsible for administering medications without knowing what they're administering, or without knowing, what. This isn't always true, but it's certainly sometimes true. And the ostensible reason is to protect the child's medical privacy, but it can be crazy.
Alondra?
So thanks for the panel. I thought it was incredibly interesting. I guess I wanted to make one comment related to Michael Ross and then pose one question. And the comment was really about the vaccination story, which is so compelling, those examples. But I was struck that with H1N1 and with the autism vaccines, you have completely, seemingly sort of opposite sort of social outcomes or social sort of processes happening. So with H1N1, the non-compliance rate was really high among African Americans, for example, for sort of historical reasons. So there's all this literature that people didn't want to take the H1N1 vaccine because they were afraid that it was a government conspiracy because of the Tuskegee experiment. And there were cases, for example, the Public Health Authority in Los Angeles was actually specifically working in these communities to dispel those myths and get the vaccines to people. And so I guess I just wanted to and then with that, with thinking about the community that you were talking about with regards to the autism vaccine, and your own, the pediatric setting that you're working with, I wondered if there was a sort of institutional setting that made those people more inclined. I guess I'm thinking about the same sort of populations and how they reply to, respond differently depending on what the institutional structures are for where the vaccine is being sort of administered. And that's just kind of a comment. My question to the journalist was about the way, whether or not you think that the work of health and science journalism kind of primes the pump for these political controversies around science, and the ways in which the embargo system works, and the ways in which, there's an economy of getting the paper and the findings out quick and fast, right? And then, of course, as Eric suggested, science is, partly about nullification, but the news doesn't report the null findings. There's nothing sexy there. So, so I wondered if, where the journalists might position themselves in the sort of economy of the politics of health and science.
Sure, no, that's a great question, and I just should be clear, compliments. We've never met, and yet you teed me up to talk about my 2 blogs, which I was careful not to talk about just because I didn't want to sort of be proud of them, which I am. So one is actually called Embargo Watch, and although people maybe on this floor assume that's about Cuba or the Sudan or somewhere Iran at this point, it's actually about scientific embargoes and the fact that my feeling, and I don't want to get into sort of my own neuroses here too much, and I'll hold off. Maybe we'll do this over a glass of Cabernet. But my feeling is that journals have, and with the absolute sort of compliance, if you will, of journalists, have really completely assumed control of the flow of scientific information. And I know that's a big statement, and Eric was trying to be provocative and incendiary, and hopefully that was too. But what journalists have done, and it's not even so much the embargo, it's actually this wonderful, and I say that with big quotes around it, thing called the Inglefinger Rule, which basically says that a journal will not publish something unless if it has appeared anywhere else, including the press. So you can understand why they would do that. This came up about 40-something years ago now, because they didn't want things to go out without peer review. Esther talked about peer review and that sort of process. So to answer your question, I think journalists have allowed the system, have allowed journals to control that, and I think they need to take it back a bit and start being more skeptical, which is what we try and do, and which, if you go to Health News Review, for example, healthnewsreview.org, run by a terrific guy who's a good friend of mine, Gary Schweitzer. He actually looks at 10 rigorous criteria for how stories represent the evidence that they're reporting on. I like to be able to say, because it's true, that many of my staff stories do well, but a lot of others don't. And I think that actually gives people data. And he's published some on this. I'm sure he'd welcome other people publishing on that. So this embargo system, which really means that every Wednesday you're going to read about New England Journal, and every Tuesday JAMA, and et cetera, and the fact that it's like that, the dog and the squirrel, that sort of meme that happens, you know, I'm so interested in all this stuff, and oh look, squirrel. And that's what happens on Tuesdays. So you have to report on JAMA. And if a study comes out having the words autism and vaccines in it, then everyone's going to jump and do it. And I'd like to think that when we do it, we're more skeptical, but again, there is that constant need to do that. And I think that journals and scientific societies work hand in hand. Now, as far as and the reason I'm chuckling here, as far as the not reporting on when things are overturned, I have this other blog, which is called Retraction Watch, which sort of gets to what Eric was talking about in terms of science progressing, and there are any number of great sayings on this that I certainly didn't come up with. Progressing by making mistakes, progressing by figuring out what's wrong. The reason I do Retraction Watch is more about transparency and the fact that I find a lot of journalists to not be very transparent when it comes to that. So I'm totally with you and others. I happen to agree, and I think that the leaders of the group that I'm with, Association of Healthcare Journalists and others, completely agree that the problem is that what we have ended up with in terms of people who cover science and health in this country and certainly elsewhere, true too actually. I was recently at the World Federation of Science Journalists meeting in Doha, talking to a lot of colleagues from around the world there who are facing, if not worse problems than we are. You don't have experts in those roles anymore. And it's not to say that everyone is always doing a wonderful job. To be a little Pollyannish, I happen to think that the rise of people, and I don't think this contradicts what Eric is saying, I think it actually speaks to it, but maybe in a different way about the internet. The fact that there are an awful lot of real experts out there, or people who have expertise in certain things, who are doing great stuff and don't need a paycheck to do it. Actually, I think in terms of science, it's actually boosted and many bolstered what's happening in science and health coverage. But I recognize that that's not necessarily a long-term or complete solution for what we're looking at.
I just want to make 2 quick points on the... Do I need this? Can you hear me? I want to make 2 quick points about the journalism story. The first has to do with journals. So one of the ways in which the scientific journals become part of the problem is that they're actually not accessible. They're certainly not publicly accessible. Now maybe this is at odds with my claim that people couldn't understand them all that well anyway, but I do think it's significant that while there are facts everywhere, the kind of scientifically hard-won facts are available to people who work in universities and have very expensive library subscriptions. And so it's actually quite difficult to get information that could be taken seriously in other contexts. So there's a scandal around academic publishing that has to do with the amount of money that journals charge and the way in which they even treat the actual intellectual property that they control. And that's kind of a thing in and of itself, but this kind of movement to try to democratize knowledge that's produced in the world and the ways universities are participating in that is kind of an interesting one here. Maybe too much of a sidebar for us to get into. Then just kind of one note about journalism and science, which is to say that we are not a representative panel, and we should keep that in mind. And by that I mean all the good scientific reporters who are out there have a real hard time competing with all the kind of misinformed conversations about science and health that you find in other parts of the media system. AM talk radio, television news magazines that that are concerned with health. I think there's a lot of very weak reporting in those venues, and I think that's not even to mention the kind of world of the internet publications that have their own facts.
But is that science? I mean, wouldn't you say that about the reporting of social science as well? Or
Absolutely, and it's I tried to open it up by talking about this kind of distrust of expertise in general, but I think part of the problem you have at the New York Times as a columnist is you're writing to a very small set of influential and important people in the world, But there are a lot of other people who are getting news about health and science in these other forums. And so if I think of Jonathan's question about the organized attack on science, I think part of the issue is that the place where that's being fought is not in the pages of the New York Times. It's in these other arenas which we tend not to talk about so much in universities. That's what I want to say.
Esther, were you going to say something?
So, as I understand the history of science and medicine journalism, a lot of it has been a history of boosterism, cheerleading, enthusiasm, the new, the fabulous, the cutting edge, and that I read this book that you probably all know, John Burnham's book from the 1980s that kind of charted the history of the early days. And he lays this out quite clearly, and that was kind of before this corporate era that we're in now, where the boosterism is coming not so much from the naive enthusiasm, but from paid flax in a variety of ways. So in addition to the Christian Science and the corporate science that's for the purpose of sowing doubt, then we have this corrupted science, I don't know what word to use, where the instruments that are measuring it, the parameters that are used, and everything is kind of affected, infiltrated, colored, altered, corrupted by industry's paycheck. That's at the bottom of it. And it seems to me that when I look at journalistic coverage, not only is it still suffering from a kind of enthusiasm that seems to me a little ill-placed for the seriousness of the topic, but it doesn't talk about the institutions enough. There's no article in the Science Times about medical journals or how they come about, or laboratories, or who's paying. I mean, the public doesn't really understand how science and health are done, I think, enough. And so that just brings me to one final point. You used the word anecdote, and this to me is a big mystery. Journalism is about stories, which are good, but science avoids anecdotes somehow, which are bad. And I feel like all I read in science and health journalism are anecdotes / stories, colorful examples, which to me are misleading the public in terms of their understanding of how to understand health and science. And I wonder if all these endless case examples of, 58-year-old Mary Louise are not feeding a complete misunderstanding of how to grasp the phenomenon.
I'll pass this across. I would just make the comment, you probably know more than I do about the history of medical journalism, but just to go back to something that Eric said, and to make it clear that I don't think anyone on this panel is trying to argue that science and medicine are always in the right, or that anyone who is criticizing science or health and medicine is always wrong. I think there's actually a pretty strong tradition of investigative and, in some cases, corrective journalism. I mean, just thinking, you mentioned, some of what went on with HIV and HIV-related research, but as somebody whose own medical training and medical career has seen, just to choose two other examples, huge changes in the way the profession has treated women, and huge changes in the way the profession has treated the issue of financial disclosure. When I started in medical school, nobody disclosed anything ever, not with, which drug companies use. I mean, it just would never, and I think that actually good investigative journalism gets a lot of credit for pushing Marcia, yeah, for pushing changes. So I'm not saying that what you say about, enthusiasm and boosterism is wrong, but I think it's one element in a tradition which also includes other elements, and that part of what we're talking about here should not be to say anyone who is doubting medical therapies or medical received wisdom, I'll stay with medicine because it's what I know, but I'm sure people would extend it to other science, is therefore, a Yahoo and should be ignored. I don't think anybody up here had meant to say that, but you know much more about it.
I just would say that the investigative part has been in the business pages of the Times, and not in the science and health section, and that to me has been a big mystery, that the challenge to the corporate public-private partnership rhetoric has come from the business journalists who were charged with, peeling off the outer skin and looking at what was underneath. And as myself, a scientist, I started reading the business section of the Times to understand the institutions that were dominating the situation. I certainly wasn't interested in business, never was, never would be, except it turns out medicine is a business, which was a big surprise.
Yeah, I was actually going to answer by not saying exactly that, but something close to it. And David's here, and so we should maybe give him a chance to actually respond if he is willing to. I think that, and it dovetails with what Mary said, which is that, and I think that it speaks to the ghettoization of sort of what we think of as science journalism. I happen to think that the first, sort of goal of journalism, the first reason why journalism should exist, should be to be skeptical, should be to hold people accountable. For whatever reason, in a lot of science journalism, and I actually don't think that the Science Times is particularly guilty of this. I think that there are other organizations that are probably much more guilty of this. There is a lionization of scientists and of doctors, quite frankly, that has happened that I think is eroding. I think that that actually is part of what is happening in terms of how the world and how this country feels about experts. And the fact that you now have people talking about conflicts of interest. You have ProPublica literally posting all of you can search for your doctor and see who they've taken funding from. But, if I may play devil's advocate a bit, scientists don't like those kinds of questions. And maybe that's because journalists haven't typically asked them. And that's a fair point. However, I can tell you that I always tell my students, I teach journalism here, always ask about conflicts of interest, but don't make it your first question. Because most scientists don't really want to talk about it. And if you look again, going back to Health News Review, most studies don't include how much something's going to cost, and they don't include conflict of interest disclosure. So I think, we need to sort of think about not ghettoizing science. And it's funny, and again, David can speak to this far more, with far more knowledge than I can, but it was because there was a great opportunity in creating sections and advertising and things like that in the 70s that we have sections, including the Science Times, but others as well, some of which have gone by the wayside. So it's this kind of, I think it's a complex thing, and my feeling would be if we could imbue the people, and that's what we try to do here, certainly in SHRP at NYU, and also other programs do the same, imbue science journalists with, you can maintain your wonder with science, and your belief that science as a rational way to look at things is probably the best way, but also remember that it's a human enterprise, and that it is filled with, and it's not just medicine. Medicine is, because we all end up being patients with one stripe or another, and there's so much money involved. Science is the same way, and we somehow also, I think, ghettoize science within science and health journalism. So,
I'd love to hear a comment from David, and then we have a question in the middle. I would just add to this point that both the questioner and myself, as maybe a bit of context, have been jaded by our relationship between journalism and the pharmaceutical industry, which we both have backgrounds in, and so I know that this particular issue is particularly salient for people who have studied issues like, I mean, I was an expert witness in one of the cases, and looking at the ways in which, you know, this, I mean, obviously, journalism, health journalism, science journalism, and journals are not one monolithic thing, but seeing the level of business influence on ghostwriting articles, for example, in journals, which is a huge issue that we didn't talk about, that's probably part of this. And in the case that I was a witness in, it was also influences of kind of expert witnesses and paying journals and things like that. So there is this kind of skepticism. It's also linked to some of Esther's comments about, you know, the corporate knowledge being constructed. David, do you want to?
Hi, I'm David Corcoran. I'm the editor of Science Times. And you know, your points are entirely legitimate, I think. The Times is such a big place, and you know, I'm talking about the Times now. It's such a big place with 1,100 journalists that it can be legitimately criticized for anything. And I guess I would only say, you know, we think about these things all the time. And in fact, when Michelle Bachmann came out with an anecdote about the HPV vaccine, it was the Times, among others, who called her on it. And the Science Times published a lengthy article the next week about the harm that kind of comment can do in the view of many experts. But still, you know, I think you're absolutely right. We don't routinely report when we report on a journal article. We don't routinely report on the process by which journal articles come to be, and we have done so in the past. I'm sure we'll do it again, but we can't do it every week. And one thing about web journalism is that now it allows articles about process to live on the website, so that you will hopefully in the future, have more access to that kind of discussion. And, you know, hopefully we'll get better.
There was a question up here? Yeah.
No, it's okay.
I actually have two questions. So one is maybe more, well, the first one's also a question. And that was the mammogram controversy you mentioned. You mentioned that happened 2 years ago, and I was just wondering if in terms of science journalism, you know, if somebody tells me, oh, the negative parts could outweigh the benefits, I think it would have been good to know more about those supposed negative parts, because otherwise, in the imagination of the layperson in this case, you know, it's like, oh, maybe a mammogram I didn't need, and yes, it's true, it hurts, and in worst case scenario, biopsy, big deal, frankly, from my opinion, versus not being diagnosed in time. So, and I think, especially at a moment where more and more women are being diagnosed in their 30s, let alone their 40s. So I was just wondering about this level of detail giving, because like now I know much less about prostate cancer, but I feel in terms of what I'm reading, that I'm giving a little bit more information of why maybe this test might be controversial. At least I imagine that I have a better understanding of it. So I think, so that was maybe a question and a comment. And the other one is more general about sort of the healthy skepticism of expertise that I would defend on different levels. So there is the one where we have the intentional information misgiving, like it's happened in Japan and it's happened in New York after 9/11, and people become, you know, active around it. And I think in many ways that's a good thing. But then there's also just the, and in that case also the crowdsourcing of knowledge I think is very good. And by the way, it's not just science journalists, there's a lot of artists bringing information out about health and science. So, for example, a group that designed like the devices that could network Geiger counters around the world called Patchwork. But the other one is also that one expert doesn't have all the expertise, especially when it comes to critical areas of knowledge. There's simply more than one opinion out there, especially in the medical field, I would believe, when it comes to, probably not for childhood vaccinations, but for diseases where there is just no standard course at this point. And if I wouldn't have gotten second, third, fifth, and sixth opinions throughout my life,
especially my adult life, I wouldn't be around. Because different, you just see how very renowned hospitals and equally qualified doctors who are all considered world-renowned just have different approaches. So I think that encouragement of not necessarily saying he or she is a bad doctor, but that there's more than one opinion out there, and to research it is very crucial to patients. And another, and the crowdsourcing of knowledge just on a very practical level, I think it took me a very long time to join those STAN support groups, but I eventually caved in. And most of my information on what hospital does what where, and which trial is open where, comes from patients, and which we have seen in ACT UP, and we have seen it in the psychiatric survival movement, and I think we shouldn't discredit that, and I think we should really encourage people to self-educate. So, well, on the other hand, I see all these conspiracy theories among academics also who are not in your field, you know, where it's just like, my God, you have a PhD, how can you read this so uncritically? But I think maybe rather than just saying we need better science education and people who don't have a background in chemistry can't read those STEM abstracts anyway, maybe we should say how do we inspire a critical way of digesting information specifically to science? In the same way that you look at those crowdsourced information with Geiger counters where you say, okay, we have this data, but what does it really mean? Or it's like there's a lot of activism around air pollution, and most people don't actually understand how the airshed works and how it's being measured. So that it goes on both sides. You know, it's like if you read abstracts in a field that's not yours, it's like often you think you read the abstract and you kind of get the gist. But then if you actually speak to the expert, it's like, it just happened to me recently. It's like, I'm reading a lot on alternative treatments at the moment, and I'm an integrative oncologist, and he's like, you can't just read the abstract. You have to understand if they give this dosage to this amount of cells in your blood, that would mean an amount of, I don't know, 250 milliliters, and something you could never actually take. So I need that information from the expert, obviously, to make any sense. But I guess what I'm trying to advocate for, we can't solve it all in high schools or universities. Not everybody's going to be expert on anything, on everything. But yet, you know, the tools to self-educate and to encourage that, I think, are very important. And I think the internet is an excellent place if you don't copy and paste from Wikipedia.
Please, Mr.
I just wanted to respond on the kind of patient advocacy community side. For a number of years, just kind of immediately before and after the dawn of protease inhibitors, was an editor at a magazine that focused specifically on HIV/AIDS called PAUSE, that reached, you know, about, I don't know, 250,000 people with HIV, HIV doctors, and what it meant, I think, to be doing journalism to a very, very engaged patient community or disease community was, I think, it broke through some of these questions like that you raised, Ivan, about the kind of passivity about like what JAMA's latest, you know, press releases, because the people in those very actively engaged communities want real answers. They want it very urgently, and they in a way, when there's an interaction between those needs and those concerns and those questions and the scientific community, you can have a very proactive journalistic agenda that comes out of that. You know, why are there more studies on virology and coming up with virus killers than on immunology? You know, why are there more studies on potentially patentable substances than on supplements and other potential building blocks for a treatment plan? What are these strange side effects that are emerging from these new drugs that are not yet appearing in medical journals? You know, there's a way where I think a proactive relationship between journalists and engaged disease sufferers or advocates can produce, I think, very productive journalism, and it doesn't happen that often, and I think it's harder with a more general interest science journal than when you're dealing with something as specific as AIDS or breast cancer. But I do think that there are lessons for journalism there on how to really build much more forward-thinking, proactive, not passive journalism by taking some cues from the really engaged people in those communities.
So I'll just say two things. I don't think we disagree. I just think I probably wasn't quite clear enough. So let me be clear. I don't think that improving science education is the answer to all of these problems. These are deep and complicated problems. However, I think that the unequal distribution of scientific education is an enormous obstacle to serious conversation about science and health. And that if you live in a society where the educational disparities are as profound as they are in this one, or in many other advanced societies, not to mention less developed ones, it's going to be very difficult to have a reasoned public politics around these kinds of questions. And I would insist that this is an issue that we should think of, but not the solution. So let me be clear about another thing, which is this participatory culture and the internet. My point is by no means to denounce those of us who get information that's useful for orienting our action in the world from the internet. We all do. It's to say this is a fact of our time, and we're in some ways in kind of a very infantile stage in kind of learning how to do this ourselves and also learning how to understand it. But it seems to me like if we try to understand how different competing kinds of knowledge around scientific issues circulate, if we try to understand how these debates play out, we'll really need to look at what happens when we go into these e-communities to get basic information. And I think that what's so useful about these recent controversies, like the H1N1 case or the triple tragedy, is that they're these kind of underutilized cases from which we can really see how people behaved. And one thing I want to say about this whole thing, because I've been looking a lot at this field of risk and communication, is that the reason that they did this. Sorry, this is Alondra's point. The reason they did the outreach in LA around to African Americans on the vaccination is because the CDC is very aware of the differential rates of vaccination in different areas, and the science of risk communication, to the extent we want to call it a science, is about trying to persuade different communities based on their own cultural characteristics that there's a certain course of action that we as experts recommend. And what's very interesting is that the kind of elements of risk communication involve things like making sure that the person who's the spokesperson has a kind face and seems modest and humble and has the right level of charisma to be persuasive. And this should be very disturbing to those of us who believe in science and reason, because we're already in a different realm altogether. The next thing that people need to do to be successful, or that organizations need to do to be successful in risk communication, it said, is to always preface their remarks and then to pepper their remarks with statements such as, it's early in the process, we're still learning, we're probably going to be wrong about some of this, so please stick with us as we make claims that turn out to be untrue, especially in kind of rapidly evolving situations. And what gets groups in trouble, whether they're kind of speaking about the level of radiation in 3 Mile Island or Japan, or talking about an epidemic, is if they don't make those kinds of concessions and come to speak the truth and kind of dramatically underplay the severity of some case, and then have to come later and say, actually it's worse, actually it's worse, actually it's worse, and that's when credibility disappears altogether. So I think it's a very exciting arena where people who are interested in science need to be doing work.
I would just say, in closing here, because we're getting near the time where Vanderbilt University will be upset if we don't drink some of the wine that has been provided for us. But I would say that this leads, I think, back to some of Twee's really important questions about coalition. In other words, seems like the beginning of a very productive conversation, but what new forms of coalition or activism, as Eric says, this type of knowledge progresses? I mean, can we think of new types of alliance between journalists and academics? Is the answer here to expose practices, to rebut facts? Is the answer here to occupy Wall Street in a way, or occupy someplace? Or are there other ways in which we can kind of make a conversation that is, I think, sensitive and sympathetic to, the people that Perry's talking about, for example, that are kind of on the ground and just trying to decipher health information in a way that speaks to the anxieties people have, and also to not only the policies that are happening, but also to the issues that are being left out. And I'm thinking of Ivan's point about what kind of things don't get reported, and what also doesn't get reported are negative findings, issues where we tried this, and darn, it didn't work. And part of, I think, the problem with this very polarized moment is, I'm thinking of the work of like Joanna Kemper and other people, a real silencing of the debate that's, I think Eric's exactly right, part and parcel of what science is, which is a kind of trial and error method. And when we get so polarized about yes or no about these particular questions, it makes the really valid questions about the authority of science, about the trial and error method of science, harder because people occupy these polarized positions. So I just want to conclude by thanking everyone, the audience, and particularly the panelists for giving up their Friday afternoons, and invite everyone to a reception now where we can talk a bit more about where to go forward. Thank you so much.